Welcome to 20 Questions with Vogue, featuring Forbes 40 Under 40 nephrologist Maya Namala. Hi, can you introduce yourself and your specialty?
Yeah, so my name is Dr. Namala, and I'm a nephrologist.
What inspired you to pursue a career in nephrology?
In medical school, I always found the intricate physiology of kidneys very interesting, and their critical role in maintaining overall health is very important. I found the complexity of kidney diseases fascinating and always wanted to make a difference in my patients' lives.
How long have you been practicing nephrology?
For about 3 years now.
What is your area of expertise within nephrology?
I work in the management of chronic kidney diseases, specifically focusing on diabetic nephropathy and hypertension-related kidney diseases.
Could you describe your typical day as a nephrologist?
A typical day involves seeing patients in the clinic, reviewing lab results, consulting other healthcare professionals, performing procedures such as kidney biopsies, and rounding on hospitalized patients.
How are the working conditions?
I work in a hospital. Some of my colleagues have their own private practice. I personally don't, obviously. When I work in the hospital, I have long work hours during the week and sometimes irregular schedules, like I'll get called in during non-shift work hours and to accommodate critically ill patients.
What degree is needed to be a nephrologist?
Like any other doctor, I need an MD, which is a 4-year graduate degree after you complete your undergraduate, and then 3 years in internal medicine residency. And then after this, I would pursue, or a normal doctor would pursue a nephrology fellowship, which can be 2 or 3 years. Mine was 2 years.
What is the range of salaries for a nephrologist, and what determines that salary?
6 figures, thankfully. I earn about 22K to 370K per year, depending on bonuses and all that stuff. Yeah, and obviously as you progress in your career, salary also increases.
How do you handle the emotional aspects of caring for patients with chronic kidney disease?
It can be emotionally challenging. I prioritize empathy, active listening, and providing support to help patients and their families navigate the emotional aspects of their condition.
That's nice. Can you share a memorable patient success story?
We had a patient with advanced kidney disease, and he was on the verge of needing dialysis. But through careful management and lifestyle modifications, we were able to slow down the progression of the disease, and the patient's kidney function improved significantly.
Amazing. Are there any specific challenges or trends you observe in nephrology practice today?
One of the challenges is increasing prevalence of kidney disease due to such factors as diabetes, hypertension, and obesity, especially in America. Additionally, there is a growing emphasis on early detection and prevention to reduce the burden of kidney disease.
Very interesting. How do you collaborate with other healthcare professionals to provide comprehensive care for your patients?
Collaboration is crucial. In nephrology, I work closely with primary care.
Okay, how does your background in chemistry contribute to your work as a nephrologist?
It provides me with a strong foundation in understanding the chemical processes and interactions involved in kidney function and the metabolism of substances in the body.
And in what ways does chemistry play a role in the diagnosis and treatment of kidney diseases?
It's crucial in analyzing and interpreting renal function tests, electrolyte levels, acid-base balance, and drug metabolism, all of which are essential for diagnosing and managing kidney diseases.
How do you apply principles of biochemistry in your research or clinical practice as a nephrologist?
Biochemical principles help me understand the molecular mechanisms underlying kidney diseases, drug interactions, and the metabolism of various substances in our body. So it's just kind of like the foundation of everything we work for.
I see. What role does chemistry play in assessing renal function and monitoring kidney health?
Chemistry is essential in measuring and interpreting renal function biomarkers such as creatinine, blood, urea, nitrogen, electrolytes, and various other chemical parameters to assess kidney function and monitor disease progression.
How do you utilize your knowledge of chemical reactions in prescribing and monitoring medications for patients with kidney diseases?
Knowledge of chemical reactions and drug metabolism helps me select medications that are safe and effective for patients with kidney diseases, considering factors such as drug clearance, potential interactions, and dosage adjustments.
And how do advancements in analytical chemistry techniques contribute to improving diagnostics and treatment options in nephrology?
Advancements in analytical chemistry techniques such as mass spectrometry and chromatography enable more precise measurement of biomarkers, drugs, and toxins, leading to improved diagnostics and tailored treatment options for kidney diseases.
What are some current challenges or limitations in applying chemistry principles to nephrology practice?
One challenge is the complexity of chemical interactions in the human body. There's so many, so it's difficult to understand and predict the effects of certain substances on kidney function. Also, the interpretation of test results can sometimes be complex and require careful consideration.
Very interesting. Now, can you share a significant finding or discovery related to the chemistry of kidney diseases from your research or clinical experience?
Yeah, in one of our studies, we identified a specific chemical marker in the urine that was highly correlated with the severity of kidney damage in diabetic patients. This finding has potential implications for early detection and personalized treatment.
Lastly, what are the expected job prospects for nephrology?
From what I know and have heard from others, our profession is expected to grow about 22% within the next decade, as well as the demand for care related to kidney disease and injury.
Well, that concludes all our questions. Thank you so much, Dr. Namala.
Thank you.